Hey everyone, today I'm just here with a quick video on how I deal with cystic acne and things like that. I'm gonna try and make this quite quick. Basically, I'm just making this video because when I started dealing with cystic acne in my early 20s, I really wish I had known all these things. And yeah, I hope that someone can find something useful in this if they are dealing with cystic acne. I know it's really annoying. Of course, I have to say I'm not like a medical professional, so everything I say here, please double check with your medical provider and see how that is. Especially with some of the things I'm going to mention here, you should really be careful about them. But yeah, without further ado, let's get into it. So real quick about me. I have been dealing with cystic acne ever since I was like in the middle of university, so I was like around 20 years old, and it took me a really long time to figure out even what the hell it was. I feel like skincare knowledge has definitely progressed a lot in the past 10 years, and I feel like most young teens actually know a lot about skincare now, but like I wasn't putting like face cream on my face until I was like 16, so anyways. About my skin type, I have combination oily skin or just like full oily skin with specifically inner dryness. So it's a kind of skin type where you can like slather on a lot of like creams, but you'll still feel tight inside. More specifically, pertaining to this video topic, I am suspected of having PCOS or PCOS, however they say it. I don't really want to outright say I have it. However, I'm 95% sure. First, because I have a lot of the symptoms and the way I treat it is aligned with how a lot of people with PCOS align their cystic acne treatments, right? And the second reason is my twin sister has PCOS, which she discovered not that long ago, actually. So I think there's a high chance I do, in fact, also have it. I just don't want to check because it's expensive to get formally diagnosed, okay? So what spurred this video on, actually, is a few months ago, I had a cystic acne breakout. And this is actually quite rare for me these days. It happens usually once a year, which is honestly really good. I'm not gonna complain about it, but you know how it feels when you feel like you've gone clear skin for quite a while now. You feel like you're sustaining something, and then it comes back, and you just like lose all hope, right? I just want to talk about that a bit too. You'll get bits and pieces of the story as I go through. I have some notes with me, okay? I'm gonna talk first about diet, which is by far, in my opinion, like the main thing, the biggest thing. Secondly, I'm gonna talk about supplements, which is kind of related to diet, still things you're ingesting, right? Then I'll do skincare, devices, and finally, I'm gonna talk about how to deal with post-cystic acne scarring. Before I even get into the basics of it, I'm just gonna go over my basic skincare because although I personally don't think that the skincare I use on a daily basis targets cystic acne specifically, I know people are curious about it, so I'm just gonna go ahead and let you know. Like, all the products I use don't directly target cystic acne. Like, I find it's really hard to find products that can prove that. What it does instead is just make my overall skin better. So, morning routine. I always wash my face with just water. I don't use cleanser in the morning. I've been doing this since I think I'm around 20 as well because my mom told me to do it. She thought that I was overly irritating my skin, and I've never used cleanser. I only use water and my skin's good. Well, she has different genetics than me. However, I do think she was right on this front. For my skin specifically, just washing it with water in the morning is good to cleanse off all that oiliness, stickiness without overly stripping it. After that, I go in with toner. If you know me, I like layering toners. Like, that's always what I've been doing since I have inner dryness or whatever. I think they call this flooding now. Anyways, I've been doing flooding for years. The two toners I'm using right now in the morning, because I have three actually, is the Torriden Dive-In toner. Honestly, I don't really like this. You see, I've been using it for like a month, maybe 3 weeks. I don't really feel anything from it, so just ignore the fact that I'm listing this, just sharing it with you so you know. Then I also use the Kikumasamune, what's it called? High Moist Skincare Lotion. This one, however, I highly recommend for general skin care, like if you have skin like me. After going in with those, I go in with vitamin C. This is Melano CC Premium Essence. I don't always do this because it's a bit oily and heavier. And generally, since I'm going to put makeup on after, I rather my skincare to not be too thick or else my makeup doesn't apply very well. Then I use this Numbuzin serum. It's the Numbuzin Pantothenic B5 Active Soothing Serum. So number one, the new number one. I actually really like this. I use it because it's hydrating and it's also very like watery, so it absorbs really fast. Then I use cream, and that's the hadalabo Gokujyun Snow Dew Cream. Finally, which I think is important in this whole discussion, is sunscreen. So I use the Skinaqua Tone Up UV Essence. So yeah, wash face with water, toner, sometimes vitamin C, hydrating essence, moisturizer, sunscreen. For night routine, La Roche-Posay Effaclar Cleanser. Then I go in with the kikumasamune toner and also the torriden one, but like we don't like the torriden one. The hadalabo toner, which is the Shirojyun Premium Toner. I use this one at night specifically because it's thicker. After that, I use retinol. This one is by The Ordinary. I've only started using this like a week and a half ago. Don't really know the results of it, but yeah, that's what I'm using currently. I follow up with Nimbuzin Skin Softening Serum. This is number 3. It's almost done, as you can see. Then night cream. This is the Medicube PDRN High. I keep mispronouncing this. Oh my god. PDRN Pink Hyaluronic Moisturizing Cream. I really like this night cream. That is the general routine I have. Again, like I said, this is just for general, like, keeping your skin moisturized and glowy, all these things. Not so much for cystic acne, but that's, just so you know, that's what I use. The only products that are a bit relevant here in this discussion are things that reduce scarring, but I'll have a section on that later. So let's talk about diet, because I think it's extremely important in this talk. I don't have like a solution that fits for everyone. However, I am asking you, if you have cystic acne and you're concerned with it, to pay attention to your diet and try and figure out what foods are like triggering your acne, because for sure there is probably something you're eating that's making it worse. Right? It could be inflaming your skin, it could be causing like hormonal breakouts, whatever it is. You need to check it. The way you could check this is by maybe looking through a list of suggestions of things that generally irritate or cause cystic acne, cutting it out for a week or two, seeing if it makes any difference on your skin, and then going through all of them like that. I'm gonna talk about the 3 that I have that like I cannot eat. These may apply to you, they might not, but yeah, here's my experience. So first of all, I talk about this all the time. Like everyone seems to notice about me because I'm always complaining about it. I can't eat dairy. So this is a bit strange because it's actually not all dairy. So things I can't eat are, of course, straight up milk. I can't have ice cream. I can't have chocolate unless it's 100% dark chocolate. I also can't have a lot of cakes if there's cream or icing. There's also certain cheeses I can't have, for example, fresh mozzarella. However, I can have things like Parmesan, which is like a hard cheese. I also can have yogurt. Don't know what that's about, but I'm glad because I love yogurt, so that's fine. So dairy is one of the biggest triggers I had, and it's like a bit embarrassing to say, at least 3 or 4 years to find this out when I had cystic acne. I wish I had pictures to show you about my cystic acne, but just so you know, I had acne all over here, like this, all around my mouth area. So down the chin, around my mouth, to the point where I had to take painkillers to sleep at night because the throbbing would be so strong. I would have like 10 to 12 of them active at all times. It was honestly like hell. And I'm also one of those people who always get like the triple volcanoes as cystic acne, you know, the one with like 3 heads at once in one area. Crazy work. Since I don't have a picture, I'm just gonna tell you what one of my like former friends told me. She once saw me and said, like, made fun of me for this. She said it looked like I had a beard. That's all you need to know with how bad my acne was. The second thing I want to point out, which is something that was much more difficult to discover because I did not consider it, like it wasn't something on my radar. I didn't even know what this was. It's lanolin. If you don't know what lanolin is, it's like the thing Aquaphor is made of. This is in terms of like ingesting lanolin. I'm Googling so I can tell you. Lanolin is wool fat, wool yolk, wool wax, sheep grease, sheep yolk, wool grease. So basically it's kind of like this kind of waxy material from sheep. You might be wondering, where do you ingest this? Well, for me, it was in the form of my vitamin D supplements. So my vitamin D supplements were like those really small transparent ones, and it actually used lanolin. So every time I took my vitamin D supplement, I would break out, and I wouldn't be able to trace it to the vitamin because I didn't really think anything of it. I didn't really consider it something that could cause a breakout. And just to be clear, it's not vitamin D specifically, it's a vitamin D supplement that's non-vegan, so that uses lanolin. And I'm just putting this out here because it's honestly, c'est pas évident. You know what I mean? So consider that. That one I actually discovered only last year when I was in Canada on vacation. When you Google it, there will be things that come up. However, it takes a lot of Googling, like every single thing you eat, and like all those little things to see if it actually makes an effect or not. For me, I'm actually not that good at keeping up with supplements, so I was only able to connect the dots because it had been a while since I didn't take my vitamin D supplements, and I decided to take them before heading off to my trip to Canada, and so that was how I was able to pinpoint it. Now, the very last one that I recently discovered, I know this sounds really stupid, but I discovered it with my last breakout. It's butter. And you might be thinking, girl, butter is dairy. And I'm like, yeah, it is, but I've never had an issue with butter until now. So what happened was when I went to Korea in April, every morning I had like butter on bread, and it was so good that I decided to buy butter myself. And I'm from the south of France, so I'm so much more of a olive oil girl than like a butter girly. And because of that, I never have butter at home. So what happened is around May, I bought some butter, and in June, I was basically ingesting a lot more butter than usual. So normally it would just be like some occasionally, like once every week or two. And now it was like twice a day. And it caused such a severe breakout. So yeah, butter is definitely another one that I have to pay attention to, but it's not as strict. I can have it now and then, right? Compared to milk, like I literally can't have it. I have a drop and it's like boom, acne. And it takes a while to get it out of my system too. The reason I'm bringing all of these up is just to provide you with some examples, but also to let you know it's not really, it feels much more reassuring when you have cystic acne to know the cause of it and to know I ate this and this is why it happened, because it's so frustrating to get cystic acne and just not know the cause of it, have no idea why it is that you are being plagued with these painful cysts, right? And just to illustrate, I'm gonna put up some pictures and stuff here of how my cystic acne breakout looked. I think my phone broke in the middle, so I'm missing some of them. I'm also going to show you how my skin actually looks right now under the makeup. The last cystic acne that I had from that whole breakout, it lasted about a month and a half. It stopped around 2 weeks ago, right? So I think in all I had about 10, maybe around 10 cysts. Some of them were the same one reopening like again and again. And yeah, right now I would say that my skin, like the healing has started. Like I'm trying to fade the scars. But yeah, just as a reassurance, just know, even if you do everything right, that you are going to encounter things that might trigger cystic acne again, and that's okay. You can always work on repairing your skin. I know it feels like the end of the world when it happens. I know I'm like super dramatic. I'm like, I don't want to go outside. I don't want to do anything. Oh, this is like ruining my life, right? But like it will heal, right? And I know my skin looks pretty decent now, but like please trust, I've never had good skin in my life. Like I've always been a person with bad skin, so I know how it feels. So that's all I have to say about diet. There are some other things you might want to consider, such as reducing your sugar intake, or maybe if you're eating too many oily foods, you could also try cutting or reducing those and seeing if it affects your acne. By the way, I'm not sure why dairy affects it so much. I think, like I'm not professional, but I think it's because dairy, like milk, has a lot of hormones, and if you have cystic acne, it's due to like a hormonal imbalance. Specifically, like PCOS acne is like having too many androgens, like the male hormones, so it kind of like fucks up your hormones even more, which leads to more acne. That's my understanding of it. Please correct me if I'm wrong. Now, moving on to the supplements aspect of it, these are also things that I eat in order to just improve my acne, or I guess like acne / skin in general. The first thing I want to say is I do take birth control. So after university, I was like 21 or something. I actually went to the doctor because my acne was just so bad. Like it was causing actual pain. I remember once I was having lunch with my mom and she just started yelling at me because she pitied me so much because my skin looked so painful. I was like, girl, what am I gonna do about that? Like, why are you mad at me? But like that aside, and my doctor was the one who first like put the two together, that I had not had my period for like 3 years at that point. And I was just like, woo, I don't like having periods anyway, girl. So let's go. Turns out that's also a symptom of PCOS, and there were some issues there. So I actually got put on a very specific pill called the Dian 35. And this is a pill that is like highly regulated in France. I think you need to get like a blood test every time you get a prescription for it. In Hong Kong, it's quite different. You can just go and get, like, you still need to go to the doctor to get it prescribed, but they don't take a blood test at all. But yeah, it is a pill that is like quite high in dosage that specifically targets hirsutism and acne. So hirsutism is like, I think, like having a lot of hair like growth, and that's also another symptom of PCOS that you can get. I do think there are some issues with this pill. Like, you do need to properly get tested for it. Please don't order online on a sketchy website because it can cause some issues, right? So this is one of those things I definitely think you need to go to your doctor for, and please ask them about it, right? It's really expensive in Hong Kong. Like, it's about, I think, 30 USD a month, which is kind of expensive, which makes me want to kill myself, but like, it's a price for having good skin. I would say taking that specific birth control, because I've tried other ones and they don't work on me. That specific one, it has reduced my acne, like the cystic acne, by 50%. So I was taking it and my acne was a lot better, but that wasn't enough. And there was a second thing that I think made the most difference along with my diet. So imagine I was on the pill, I was eating no milk, I would still get like 1 cyst per week or something like that. Like, I would still get acne. It was just more manageable. The one thing that finally cleared it up is spearmint supplements. Girl, spearmint supplements. Swansons, they are my bro. Like, they are my friend. They have me. They got me. So I first heard about spearmint when I was like searching this shit up. When I first kind of realized I had PCOS, and I realized that a lot of people were taking this because it's like a natural androgen suppressor or something like that. And I didn't really know if it could make a difference because it's just spearmint. It's like the thing you have in chewing gum, right? Don't eat the chewing gum, it's not the same. I actually started by getting spearmint tea because it's like a very like low bar entry to try something out. And let me tell you, even the tea made a difference. Like, just drinking the tea every night made a difference. And since I don't really like the taste of like drinking bubblegum flavored tea, because it does, like, this is something you associate with like mints bubblegum, I switched to supplements. They're really, really cheap. And I bulk buy them every 2 years. Like, I think I buy around 20 at a time, like 20 of these bottles or something, and I just go through them. I take one every night, and sometimes when I have really, really bad acne, like I'm having a breakout, I take 2 every night. So it depends. But I think having 1 every night is like more than enough normally. This is another thing I want you to check with your doctor, because it's also like, you can't have this if you have a history of blood clots. So like my friend, for example, she can't take this because she's had blood clotting before. So if she takes this, it would exacerbate her risk. So please go to the doctor and see if you can take this, okay? Please don't just go buy it without checking these things, okay? Oh, also, it has to be spearmint. It can't be any other mint leaf, okay? It has to be spearmint. Last one is not specifically for cystic acne, but I do take omega-3 as well. With that aside, I'm gonna talk about devices. And when I say devices, I mean a device, like singular, because I actually only have one. But it's an important one to show, so let me pull it out. This is a high frequency wand. It sounds so fake, but trust me, it works. This one is by New Derma Clinical. You can find it on Amazon. However, I just want to let you know, it doesn't have to be the one on Amazon. They're like white labeled, so you can find it for way cheaper. I just didn't know when I bought this that I could actually buy it cheaper on like AliExpress or Taobao. They're like the same ones. It's just like they slap their logo on it and sell it at a premium. I keep everything in the box because, as you can see, there's lots of glass components to it. So what you have is basically the main device, right? And you have like the level that you can use here. And you have a lot of different wand tips, right? Like, here are some example of wand tips. Like, this one is for your scalp or your hair. This one is like a mushroomy one. It's for like the surface of your skin. And this is the one I'm gonna talk about the most today because it's the one I use almost exclusively. So what you do is you put it here, boop, like this. Then you turn it up, and it's gonna make a weird noise and it's gonna smell a bit weird. And with this tip, you just zap your fucking acne, like, psst, and like, bitch, that shit will be gone the next day, hopefully. With exceptions, put a little asterisk in there. The way you're meant to use this is you're meant to put a piece of gauze over the acne, over your skin, and than like zap it with the gauze, because if the gauze kind of helps it create like an ozone layer, which is like better at doing its thing, right? I don't always do that. I kind of just get lazy, because when I have cystic acne, I'm like doing this like every single night, right? Zapping every single one. I just go like, imagine there's acne here. I just go like bzz, bzz, bzz. That's it, 3 times. And not longer, because you can like, it doesn't hurt. You feel like a spark, but it doesn't hurt. But it's like, it doesn't really make it more effective to do it longer. So you just do it 3 times and boom, you're gone. You do it directly on the acne. You don't do it like all over your face. You can use like that mushroom one I was showing you for all over your face, but I don't do that. Let me just tell you like the caveats. So first of all, if you have a lot of cystic acne, let's say you have like tons of it and like they're all in the same area, like they're breaking out all in the same place, like in the pictures I was showing you where I had like a bunch on this side and on this side, then there's a high chance this won't work because it's like spread out too much, I guess. I'm not sure. What it can do is reduce the time it takes to like deal with it. So when I zap cystic acne with this, there's 2 things that occur. First is if the acne is not visible yet, like, but I can feel it, you know, you feel it coming. If you zap it then, there's a 50% chance it just disappears, like it just doesn't come to a head. However, there is still a chance it comes to a head, and that's the second scenario. It comes to a head, you keep zapping it. Instead of taking like 2 weeks to disappear, it disappears within the week, like within 5 days. I think that's good enough for me. So not a magical tool, but something I have found quite useful. It is expensive from what I recall, but again, I think you could buy it cheaper if you go directly to the source who produces them. Oh, by the way, before you use it, disinfect it, use it, disinfect it again. Take it apart, put it away. All right, so what I'm gonna do now is go through the steps of treatment that I use. Like, this is my method when I have a cystic acne breakout. This is what I was using in the past few months. So first, like I said, if you feel acne developing under your skin, use the wand to zap it. So when it starts coming to a head, you know, it's not like a white head yet, but it's still under your skin. It's red, it's swollen, it's kind of lumping up. What I like to do is I like to use a hot compress in the form of a tea bag. I use specifically chamomile tea. I think I saw it in a tip on like Reddit or something. I just brew a cup of chamomile tea. It's very easy to get and I tend to have it at home. I make my tea, you know what, and then I just take the bag once it's done and I hold it against my skin until it is like it's not hot anymore. Don't just take it out boiling and then put it on your skin. You're gonna burn your skin and make it worse. Make sure it's like not uncomfortable to the touch. What this usually do is just it brings it to a head a bit more easily, a bit more quickly, and also it does feel a bit soothing. Instead of actually drinking the tea, what I tend to do is I keep the tea in the cup and I let it cool down. And when I wash my face that night, I use it as my last step to, I wash the cleanser off with water and then I splash my face with the chamomile tea, like the whole face. Then I just go with my normal skincare. When I have cystic acne, I think the most important thing is to make sure you keep everything moisturized. I don't like drying things out. Another thing you can do is try those patches that have little spikes in them, like magnesium spikes or things like that, to put on top when they haven't come to a head yet. Sometimes I feel this works to reduce the swelling, and sometimes they disappear without coming to a head. I personally like these when I'm like, I remember I was using them at the airport a lot because I didn't want them to be exposed to like tons of stuff, but whatever, that's what I was using. I don't think they're completely reliable, but they can work. So let's say you've done all that, your acne has come to a head, you have like a white head. Then I disinfect a needle and I actually lance it. Unless it's in like this area, like you see where I mean, like this area, because there's a high chance it could get infected and like have severe consequences. So please avoid lancing things like that over here. On your chin area, I think it's pretty safe, right? So you disinfect the needle, you lance it, disinfect the needle again. Then what I do is I don't squeeze it, like, okay. You know when you have, let's say, acne like here, and your instinct is to go like this, to like squeeze it out, instead of like squeezing it out like that and then only blood comes out and it hurts and da. What I do at this point is, imagine like my nose is the acne, okay, on the screen. Instead of like squeezing it out like this, right? What I do is I put my fingers a bit further flat and I just push down on the skin because that is more effective at getting things out. And if there's anything that needs to come out, just doing that will get it out. If it doesn't come out doing that, then doing that would not have helped. So that's what I do. I press down lightly, I wipe it off, and I immediately put a pimple patch on it. I've used a whole bunch of pimple patches. They all work the same to me. It's just use whichever one you like. And you are gonna keep doing that, putting your pimple patch, removing it, like pushing it down very gently, wiping it, disinfecting it, putting another pimple patch over and over until it's completely drained, right? Completely drained. You know when it's out, like when it's drained, like properly, when you touch it, it doesn't hurt anymore. After that, moisturize the area very well while it heals. I personally avoid putting any actives like around like my acne when it's like open, you know, like when there's an open wound. So I'm very careful with that. Keep moisturizing, etc. And when everything is finally settled down, you can then work on healing the scarring. Well, what do you do to heal the scarring is what you might be asking. Very good question. Let me show you. I have some stuff here, but I'm going to show you the most obvious one first. First, you need to use your sunscreen. You need to use it every day, and you need to reapply it, okay? So use your sunscreen even if you're going to stay indoors, especially in the area where you have your scars, because like the sun will make your scarring worse. So please use your sunscreen. That's like just la base, the basis. I do have some other things though that you can use. The first one that I use the most is the vitamin C serum. It doesn't have to be this vitamin C serum. However, I can vouch for this one. I've used it nonstop since I think 2018 or 2019. Now, if you want something a bit more targeted, I do have azelaic acid. I know you could buy this in the form of like serums and stuff like that, creams, which I actually am interested in. I'm going to go to Korea soon and I'm going to look into that. However, I have it just in like a tube like this. This is the form I have it as. And I got this at the pharmacy, the local pharmacy. It's Azelderm and it's azelaic acid 20%. 20% is really high. It's not something you're meant to put all over your face. So what you do is you put it like spot treatment, like you put it right on top of it. Sometimes you can use this on active acne, but I've done that, but I really don't like it because it dries up the skin a lot and I feel like it causes more irritation. So my approach is to try and irritate less and promote healing, like moisturizing it more. Keeping it clean, moisturized, etc. We don't want things peeling and like hurting and stuff like that. So sometimes if the scar is pretty bad, like a really big one, let's say it's an area where a lot of them clumped up together, I put it very lightly at night. And the reason I put it lightly at night is because it does hurt. It gives me discomfort. I don't like it. It makes me like itchy, right? But it does work because like within like the next 1 or 2 days, like some dead skin will like peel off from it, right? I don't use this very much, but it is an option. I think if you want to use it for acne, you might have to use like a serum with a much lower dose or something like that because it irritates your acne directly on top too much. The other thing that I like to use for scarring, and I guess it's overall skin, and this is the ordinary, like the red thing, was it? AHA 30%, BHA 2%. And that's like it's like that red mask, you know, like the blood mask. This is really good at promoting like your skin to like, you know, do its thing, look more fresh, stuff like that. I also feel like it helps a lot with scarring. However, don't use this every day. Like, girl, don't use it every day. I use it once a week at most, but generally it's once every 2 weeks. You know, 2-3 times a month kind of thing. And if you're new to using this, please don't leave it on for more than 2 minutes. Leave it on for 2 minutes and then wash it off. Please don't push yourself, okay? I leave it on for 10 minutes now, but I've been using this for a while. I do recommend it. It does work. Your skin will look glowier and it does help with scarring quite a bit. But again, with scarring, things take a while, right? So you won't ever get like overnight results. These are just things that can help. I just want to put a little note to say I'm not someone who experienced a lot of scarring that creates dents in my skin. So I don't actually have any tips for that. So sorry. I think that's it. I think that's all I have to say. Well, I hope that you found this video helpful, and if you have any questions, please don't hesitate to ask, or if you have, you know, additional tips of things you do, you're welcome to include them down in the comments as well. I know how it feels to have cystic acne that's like crazy and it feels like it's completely out of your control. So I hope that in this video, I at least gave you some pointers on things to check out, either with your doctor or, you know, very simply like cutting things out of your diet and things like that. Anyway, that's it for me. I hope this wasn't too long because I want it to be kind of fast, but yeah. If you are interested in other videos, I'll have some stuff up here. And yeah, I'll see you in the next one.